To understand why I developed Tripleflex, you have to understand the nature of central nervous system disorders like spinal cord injury, multiple sclerosis, or even traumatic brain injury. Many of these patients have a condition known as foot drop. But unfortunately, a lot of those patients also have hip drop, wherein the hip flexors are extremely weak and the patient is unable to lift the leg from the ground.
With MS, fatigue is a #1 concern for me. It really has limited my ability to deal with my gait evenly, and my right leg has been doing 80% of the work because my left leg suffered from my loss of my extensor muscles, and so that's made it even more difficult for me.
Many patients often reject ankle-foot orthoses, mainly because they're uncomfortable or they're very restrictive.
I've tried other AFOs in the past, but they've been very uncomfortable and very constricting, and they didn't lift my hip.
So I knew I had to develop something that would give the hip more activity than otherwise it could on its own. Well, one of the benefits of Tripleflex is that it's very open and flexible, and the elastic bands actually add energy to the step, lifting the leg from the ground as the patient walks. Now, most patients with hip drop cannot do that, so the system adds the appropriate amount of lift to clear the ground. That's something ankle-foot orthoses cannot do. One of the more common complaints I hear from patients is the fact that they cannot wear differing shoes when they're wearing AFOs. Now with Tripleflex, however, you're able to wear just about any shoe you would like, and it allows the ankle, the knee, and the hip to be as flexible as possible to maximize biomechanics.
While some orthotics have helped with lifting my toes, the hip flexion is a major component of Tripleflex. It makes a huge difference in my level of fatigue and balancing my gait and coordination, and allows me to have much more flexibility in walking.